Eucharisto, kai kalimera, and this is really the moment where I wish that my Greek existed so that I could have followed the discussions that just took place. It's a pleasure to be with you, even though remotely I would much rather be there in person this afternoon. And thank you for inviting EFGE to speak on this very important topic. COVID-19 has indeed taken over our lives since certainly over 1.5 years, and it is a very important moment to reflect how we can build back better and how this incredible challenge can also be perhaps an opportunity for health systems in Europe and around the world to build back better. Certainly what we've learned with this pandemic is since the very beginning that collaboration was the solution together with innovation to come out from under this pandemic's cloud, if you like. And as an industry, we immediately worked in these 3 areas, accelerating all our research and development activities and supporting other publicly driven initiatives in order to find therapeutics, diagnostics, and vaccines as quickly as possible. The industry also stepped in immediately to provide financial support and in-kind donations. As you know, on the ground, we started with our masks and our gloves and everything else. And then, of course, what we had to work on was making sure that the supply of medicines, even before there were any vaccines, just the supply of medicines around Europe and around the world could continue despite borders closing down and various other difficulties of lockdowns. In the meantime, the fantastic news is that 4.21 billion people have already received their first dose. Of course, this is not enough. And we as an industry are on target to produce 12 billion doses by the end of 2021 to make sure that everybody who can be vaccinated and wants to be vaccinated will be able to be vaccinated. I think the other important thing to know is that from the beginning of the pandemic, and I'm trying to go to the next slide, but my internet clicker is not working, so maybe somebody else can move to the next slide for me. As an industry, from the very beginning, we published our commitments to make sure, and these are written very small and I don't expect you to read them all, but to make sure that it was very clear that we took our role in this pandemic very, very seriously, that we knew that we had a huge responsibility in the research and development of the solutions to fight the spread of COVID-19. We made sure that we worked very closely with all the institutions, including the European, but also the national ones, to identify potential treatments, to launch the development of potential vaccines, collect the learnings, and make sure also that we worked with governments to ensure that treatments and vaccines, when they became available, would be available and affordable for everybody. I think it's important to know this because often in such a pandemic, we've been running very fast, and we wanted to make very clear that we took our role very seriously. But what have we learned from the pandemic? And I think this is very important. There are 3 areas, priority areas, that were highlighted as topics to address. COVID really tested our resilience and agility in Europe and in the rest of the world, how our health system were able to respond. And it cast a light, in a way, to the good things, but of course also to the weaknesses of our systems. What we did in the industry is we commissioned a report from PricewaterhouseCoopers to be able to understand where were the weak areas and what could we do better, where were the areas where we could have opportunities for improvement. And the first one was really, it was clear that there was a delay in foregone care for non-COVID-19 patients. So clearly that there was a need, sorry, and I'm having trouble with my special clicker here, remote clicker. There was an inability for many patients to access routine visits, testing, screening, diagnosis, and elective procedures. And some patients even refrained from seeking care because they were afraid. And if it's difficult now, we're used to COVID, but 18 months ago, if you remember, it was a very different feeling. Also, another area that was highlighted was the future financing and need to increase system efficiency. It was really clear that there are contrasting forces in healthcare budgets, and the resources to respond to COVID-19 and to roll out vaccination plans and prepare for future developments or crises versus the dampened demand in other areas. And then the third area really that was highlighted was the need to refocus innovation on patient and societal needs. there's really an unprecedented convergence of multiple stakeholders to work on COVID-19 vaccines and new therapeutics. It showed a whole new way of working. And then the success, of course, is a direct result of these multi-stakeholder initiatives. And we need to really think about what it will take to create similar momentum, to look at some other areas where we need improvements in health. So out of that study, we really saw that there are 4 strategic themes for the future of healthcare system transformation, which perhaps were already mentioned earlier this morning. Unfortunately, as I said, my Greek is not good enough to be able to follow. But I think really this Health World event on the 20th of year couldn't have chosen a better subject to deal with, because the crisis, once the crisis has passed, but even today, we really need to implement an ambitious reform agenda in order to build on the challenges that we've seen. The old status quo is really not an option. And the 4 areas that we saw was enable prevention and early care. So strengthening the prevention, the early care to preserve people's well-being. Plan ahead, explore future health and technology trends to respond to populations' evolving needs with minimal disruptions. Digitization, of course, all of you have seen how important that is, and have the right incentives around for remote delivery, and then people design care delivery around what people actually need. I've been asked to speed up, so I wish I could present these in a little bit more detail, but I'm sure the slides will be shared, and so perhaps you will be able to learn, or if you're interested, the report by PricewaterhouseCoopers is online, and you can learn more and see whether it's adapted to your own needs in your country for that reason. So really just on my last slide, the innovation for existing health challenges and future health threats. I think COVID-19 is not only a science-based and high-risk research embedded in a strong life science industry is the way to respond to these kind of threats. We need European incentive framework and a research and development framework that allows us to respond and look for solutions in high medical need, and to continue to be attractive as a region in Europe. And of course, we need the regulatory processes and the equitable access to allow all of this to make sense and be adopted and delivered to patients. Thank you very much for your time.